basically is preventing testicular atrophy from happening in the first place better than fixing it after it has happened with HCG. So should you start HCG immediately?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
What do you do, Gil? I at least have guys usually dial in their testosterone for a couple months. I mean, depends, but I don't think you're losing that much 6 to 8 weeks before you start HCG. But everybody's different. I don't know the answer, honestly. It's usually just a conversation I have with the patient to see what they want to do.
I think this comes down more to a subjective assessment where the patient has to dictate to you what it is they're expecting out of this therapy. Yeah. What is their priority? This comes down to age, family history in terms of, are you married? Do you have children? Do you want more? Mm-hmm. Do you care about testicular atrophy? What's your cosmetic priorities here? Is it a matter of increasing or decreasing ejaculate volume over time? Is it a cosmetic issue that's going to cause anxiety? Is it a fertility concern? All of these things are so specific to an individual that there is no cookie cutter approach, as there really shouldn't be with anything when it comes to hormones. Unfortunately, we know that's not always the case, but everything should be down to the individual patient and their needs. Now, much like Jordan, and I will credit him with the idea of actually doing this. We used to, a while back, start guys who are younger and want to maintain fertility on T and HCG right out of the gate on day one. And after speaking to Jordan for a while about this, I came to a conclusion that I think he's right about starting guys on just T initially, because ultimately we're looking to replace and optimize testosterone. So let's go ahead and put the cypionate in the formula. And then at the 8-week mark, when we do the reevaluation, we can always go in and drop the HCG. I don't think that an 8 or 12 or 16-week period of having no gonadotropin mimicker in there is really going to take such a drastic effect when it comes to a lifelong of actually optimizing someone. So yes, I think the less cooks in the kitchen are going to help you determine quicker which one of them is actually doing a better job at preparing a meal. So we will add HCG in at that first follow-up, assuming we're happy with the way the progression of the treatment is going overall. But I think more this question comes to not really do you start on day 1 or 2 months out. I think a lot of guys are concerned if do I kind of stay off HCG for 3 years and then decide I want kids and jump back on? And I think that's really where we have to look at it and say, look, I tell guys all the time, if you think there's a slight chance of you wanting to A, maintain fertility, B, prevent testicular atrophy and everything else that goes with the side effects of supplementing cypionate, go ahead and put the HCG on a drizzle faucet. There's no harm in taking 250, 350, 400 IUs twice a week, just kind of like as an aside, so that it is there for you. Why do you want to run a risk of 5-10 years down the road, finding out that everyone is wrong and no, you're not getting your fertility back? Just keep the faucet dripping alongside. There's no harm in that as long as it isn't giving you adverse reactions. Yeah,
I totally agree. Because I wish I had a crystal ball. Every guy, we have this conversation all the time. Every guy's different. We know freaking bodybuilders who are on everything you can imagine and they still get their wives pregnant, or they recover fine after 10 years or 15 years of use. We know guys who do one cycle and they're screwed forever, right? So I can't give people the right answer there. We just have to guide them and say, this is a possibility. You have to decide what's best for you. What risk are you willing to take? Everything comes down to informed consent in this game, right? So, but I agree with you. I don't, and again, 8 weeks on one person, it might cause an issue, but they probably had something going on already, or they may not have responded. If we hadn't, dove in and seen what the primary cause was, they might have had testicular failure. Well, HCG is not going to matter anyway. But you don't know that after the fact, like what was the cause, unless you worked it up ahead of time. So I'd rather get somebody dialed in with one variable, see how they feel, because that's the issue. I see a lot of guys right now coming to me who have originally been put on a myriad of things, and then they're trying to tweak stuff left and right, but they still have all these, they got HCG and AI and pregnenolone, DHEA, and they're all tweaking them. And it's like, why don't we just figure out how you feel on testosterone? And then once then add in the HCG and see how you feel on that, and then tweak that or whatever. So.
Hey, thanks for watching. And now click on one of these thumbnails to learn a ton more about TRT and hormone optimization.